Hi, today we're going to talk about a very common pattern behind almost all one-sided back pain, sciatica, and or SI joint pain. And this is referring to what I call a side bending pattern, where one side of the pelvis is higher and one side of the rib cage is lower. So you can imagine then that if this pattern is occurring in you, there's increased compression on this side of the spine. The nerve roots that comprise the sciatic nerve come out of the lower lumbar and sacral areas of our back and then form a nerve that comes down our leg and feeds these muscles. When you have this pattern, you're causing increased compression on those nerve roots. So today what I'm going to show you are two ways of testing to see if this pattern is occurring in you, and then I'll show you a stretch that you can do, and then finally I'm going to show you a habit that you can do that will almost instantaneously reverse this pattern. So let's get started. The side bending pattern is fairly easily tested. You can just simply take off your shirt and have someone take a picture of your back. What we're looking for is a larger crease on one side of your waist than the other. The side where the larger crease is the side where the side bending pattern is occurring. Typically, this larger crease will be occurring on the side that you're having more back pain or sciatic pain or SI joint pain. So this will confirm that the side bending pattern is likely the source of that pain. Now, the other way of testing it is a manual technique that requires a helper. And it doesn't take a lot of skill, but it requires some skill. So you could have a physical therapist, perhaps your massage therapist, personal trainer. Of course, you can have your spouse or friend do this for you too, but using a health or wellness professional who's used to touching people and feeling landmarks in the body will give you a more accurate result. You're going to have your friend kneel down behind you. They're going to be facing you like this, and they're going to put their hands on top of your pelvis like this. Now, it's important that they push their hand in and then down on top of the pelvis rather than going in like this, because this will give you a false idea of how exactly high that pelvis is. So your friend will be doing this on both sides at the same time, and what they'll notice is that one hand is resting higher than the other. The ribcage portion of this is a little trickier. Really, in this skeleton, it shows the rib cage is like way up here. However, if they just move their hand up, a quarter or a half inch, they'll feel this lower rib just above their fingers here. And so you just feel whether one rib is lower than the other. One side is lower than the other. Typically, the same side rib cage will be lower as the side that has the higher pelvis. Hence the side bending pattern name to this problem. One cause of this is a tight thigh muscle. If you have a thigh muscle that's tighter on one side than the other, it will cause this discrepancy in height of the pelvis. An easy way to solve the thigh muscle tightness, you lie down on a table and you hug both knees to your chest, and then you lower one leg over the edge of the table, keeping the knee bent at 90 degrees. Don't force the leg down. Just see how low it can go on its own, keeping that knee bent at 90 degrees. Then you're going to bring that knee back up and you're going to test the other side. And you're going to see whether one thigh muscle is tighter than the other. Typically, the thigh muscle that is tighter is the side where you have that big crease in your waist. And this is an indicator that the thigh muscle likely is a contributor to that side bending pattern. The way to correct this, simply just do this stretch and even out the two thigh muscle lengths. Hang out there for maybe 30 or 60 seconds per leg, and you'll do that twice on each side, and you'll stand back up, and if you have your friend remeasure your pelvis and rib cage, you may find that the pelvis is now level and the rib cage too. Ultimately, this whole pattern is occurring because of how you walk. Typically what's going on is when you step, let's say this side is the side where the crease is. Typically when you stand on this side or step on that side, in some way your body is collapsing. A very easy way of correcting this is simply putting your hand up in the air while you walk for 10 or 20 steps. And if you have your friend remeasure after doing that, again, you'll see that that pelvis and rib cage are now level, which proves that this is a gait pattern. All right, I'd like to take a little break and ask you to subscribe, like. Most importantly, please share this video with others who might have one-sided back pain, sciatic pain, or SI joint pain, because knowledge of this pattern of problems and how to correct it is likely the source of those problems. Thank you. Why would you be walking like that on one side versus the other? Well, in 80 to 90% of the cases, this pattern of walking is due to some older problem or injury on that same side. And I found in 10 to 20% of the cases, it's due to a compensation from the other side. Walking with your hand up in the air or even your hand on your head for 10 or 20 steps will level the pelvis and rib cage immediately. Now, if you have SI joint pain or sciatic pain or one-sided back pain, just doing the thigh stretch and walking like this will probably eliminate a lot of your pain. Again, this is showing that ultimately you've got to figure out and solve whatever older problem is on this side that you're compensating for. Okay, so we've gone over a test for the side bending problem, we've gone over a stretch for the side bending problem, and then we've also gone through a habit correction that you can employ to correct this pattern almost immediately. I would strongly encourage you to join my free masterclass for back and sciatic pain, where I'll take you through tests to help you understand why you're having pain and then give you a plan on what needs to happen to solve your pain. And I've also created some digital home programs to help people solve their pain at home. That can be found on my website at www.rickolderman.com. And I have some other free information there too, so I hope to see you there as well.